Hello, everybody. I am the proactive caregiver, and I specialize in educating others on how to be proactive by empowering you, the caregiver. Because if you cannot take care of yourself, then you cannot take care of your loved one. And today, one area that I think we kind of forget about is taking care of our vision. I know that sounds kind of ridiculous, especially for those of us who wear contacts or glasses, but the truth is, our vision is affected by far more than just putting lenses on our face to see. When we're dealing with issues or illnesses like diabetes or high blood pressure or even heart disease, low vision is an issue that gradually progresses. So today I invited Regina Budet to join me. She is the founder of Empower Occupational Therapy, a mobile practice providing in-home occupational therapy for adults coping with vision loss and facing the challenges of functional independence in their everyday lives. Regina collaborates with her clients and their families to find solutions that will best fit their needs within their home environment. She does this by providing education for strategies and resources that can help compensate for her vision loss, yet remain active in their communities. Regina has had personal experience with the sandwich generation of caregivers, an experience that has provided an insightful perspective on intergenerational relationships, learning compassion and care in her personal and professional life. So today we get to talk about what she has experienced in the occupational therapy field to what is called low vision. Thanks for joining me today, Regina.
Thank you. Thank you for having me.
Absolutely. This is a serious issue.
Yeah, it is. I think it's also one that a lot of people aren't aware about.
Right.
It gets attributed to other conditions or downplayed, maybe. The people who are experiencing it don't want to burden other people with their issues. So, we just don't really talk about it a lot, I think.
We don't. I think, and exactly what you said, downplaying it, just because in my experience with my mother, anything that was along these lines, it was something that was treated as, oh, I'm getting older. It's just normal aging. So it was either dismissed because it's normal aging, or it was downplayed because there is that panic of, oh my gosh, this is happening. What do I do? But I don't want to let anybody know that this is happening.
Yeah, absolutely. And then I think there's also that kind of justifying kind of your vision loss. So it's like, well, I'm here. I'm not as bad as so-and-so or, this
Right.
condition. I can still do this. And so we don't think about it as, being something that needs to be attended to. But, there are even just little things that we can do that can just make a really big impact that aren't even going to magnification or making really big adjustments in your environment. There's just little things that we can do that can be really helpful.
So I know when it came time for me to go to the eye doctor and I was told, oh, you're approaching the age, you're going to start needing bifocals. When we talk about low vision, we're not necessarily talking about that type of enhancement.
Right. So, bifocals is still being able to be corrected by, your vision can still be corrected by glasses.
Right.
Whereas with low vision, even with the best prescription that you could get or any kind of eye surgery, there's still going to be visual loss that you can't compensate for with that kind of treatment. So then that way, that's when we need the extra strategies, the magnifiers, the other techniques to help make up that difference.
Right. But this is more than just readers.
Oh yeah.
This is something that caregivers have to help their loved ones. And we're talking lighting, we're talking redoing environment, maybe just making things different so there's not trip or fall hazards. What have you experienced when you're out with your patients?
Yeah, a lot of times lights may be dark in a room. I don't think sometimes people who have low vision or even, some of these things are true for people with just age-related changes. They don't realize that the room is dark. So it's like, oh, then let's turn the light on and it's like, oh, I can see this so much better. or they think of globally like having a better light, like fixture light in their home, and but they're wanting to read. And so anything that really requires a lot of detail, where you're really having to look at it closely, really benefits more from having a task light or a lamp on it. Right. And then you can adjust that light even closer to whatever it is that you're looking at, and then that will be so much more helpful than something overhead. And I remember working with someone once. She just came to look at some different devices, and I think mentally she had prepared herself to look into a magnifier. And it turned out that really with just adding more light to what she was looking for, trying to read was very helpful, and where she really didn't even need the magnification. And I think that was even in itself an adjustment, because it's like she had already prepared herself to use a magnifier, and she ended up saying like, "Oh, let me think about it. I'll come back." So it was kind of interesting to see that reaction, because usually people are like, "Oh, great, I just need more light," and not an extra device. And it was the other way around for this case.
It's helpful when it's the simple fix, like that. I remember my mother's, before she moved in with us and I'd go visit her, she would always be in the dark. She would have the TV light, and all the blinds were closed, all the lights were off, and she would say she was fine. But then as soon as I started opening up the blinds and letting the light in, you could see her adjust to it, like it was too much light. But I think she just got used to being in that dark, low light and trying to function in that on a regular basis.
Yeah. And sometimes it's a quality of light too. So just having like the windows open, and maybe there's glare reflecting if you're watching the TV or on the floor, and it just, it gives you, it just bothers your eyes a little bit. So really being able to control the direction of the light sometimes, the color of the light, it can be very dynamic. Like in the morning, your lighting needs may be different than, you're laying down in bed and trying to read a book. So it can vary quite a bit. So just being able to have a little bit of control of the light, the quality of the light too, can make a difference. So it's not necessarily more, but more is usually good.
Definitely. I've been told that if I would add better lighting, then my eyes wouldn't work as hard. They wouldn't be as tired by the end of the day. I thought, oh gosh, thankfully it's something simple, and it's not getting the bifocals just yet. Yeah. So with the patients that are actually aware of what's happening and they're not trying to hide this, what are some things they need to be aware of as they're approaching, whether it's agencies or services that would possibly assist in this provision?
I would say it's definitely a journey, because this is for most, and I work mostly with age-related visual conditions. So those are going to be things like macular degeneration, diabetic retinopathy, glaucoma. These are things that tend to progress as we get older. So these are conditions that aren't really going to improve. They'll be stable, hopefully for a long time, but there is, an anticipated trajectory for this. So I think there's kind of different stages. Like we're at the beginning, just kind of getting used to the fact that, we might need something more, and kind of being open to that. Being able to get a low vision exam is helpful, because it's very different than just seeing an optometrist or seeing your retina specialist. It's more of a functional exam, and that can get a lot of things started. So they're wanting to know what it is that you're wanting to do with your vision, because we can come up with very specific strategies for that. And the better your vision is, you can tend to use one thing for multiple things, but as your vision gets worse, it tends to get much more specific as far as what we're recommending. So that kind of plays a part in it. But then starting that exam too can kind of start that process of getting tied into other services that can help you, whether it's occupational therapy, whether it's orientation mobility, if you need to start using a cane, whether it's getting connected to, resources within the state. Or even nationally, getting evaluated for different devices that you can't, or essentially also shouldn't buy on Amazon, that really need that prescription and that experience and that knowledge professional that can show you how to use the device appropriately.
Right, and make sure it's adjusted or adapted to your needs and not just a one size fits all, because this really isn't.
Right. Yeah. It's a very, it's a very person-centered, very specific, way that we're going about this. And I get that question too a lot of times, like, oh, well, my mom has macular degeneration. What kind of magnifier should I get her? And I'm like, well, it doesn't really work that way because everybody's abilities are different. Everyone's visual function's different. What she's trying to read may be different from someone else. So it's really hard to just give a simple answer for that.
So when they're going through this process, is there any help with insurance that might be able to either help, or is there information that's misleading when it comes to?
Yeah, a lot of times this is an area too where insurance doesn't cover very much. For the medical exam, usually insurance or Medicare will cover that, but beyond that, it's usually a self-pay situation. And again, that's where I would strongly recommend, starting this process early, where the financial, you can kind of start to plan, like, this is where I want to invest my money and my time. There's so many things out there once you start digging, and it can be very overwhelming and gets expensive very quickly. Even just glasses. You can have multiple pairs of glasses for different things, and those can get very costly. So insurance tends to not pay for very much. And then for the exams, and then even for the devices, magnifiers aren't considered durable medical equipment, so they're not covered by Medicare. In very specific situations, sometimes there's a specific plan that may cover a particular type of device, but that's usually a very specific thing, and it doesn't apply for everything. So insurance is limited. There are some resources in the state and some nonprofits. And again, that's where, being able to get tied into professionals within the low vision community can really help you find those resources.
Well, that's good. And I'm glad you're able to help people with that, because that is very frustrating to deal with when a lot of times people make the assumption is there. I don't have to worry about this because Medicare will cover it, only to find out Medicare doesn't.
Right.
Or the small percentages. And so they have to make do with what they've got.
Yeah. And then that also where people, that's what I find a lot too, is we didn't want to use the magnifier. I'm not at that point. And then once we start to get accustomed to, like, well, maybe a magnifier wouldn't be so bad.
Right.
Our visions progress to where that simple magnifier is not going to work anymore. We need something more complicated and expensive, like an electronic magnifier. And then that's kind of like starting that whole adjustment process all over again. Just I think knowing kind of what's out there, and then being able to kind of plan ahead a little bit about once, I'm going to need help in this area. This is what kind of device or technique is going to help me the most. And there's also a lot of benefit for strategies that don't require the use of your vision too, that I think, we forget about quite a bit. And there's a lot of things that we do probably without even thinking about it. Like we're mentioning the bifocals, but even just like adjusting a piece of paper away or closer to your face is a type of magnification. So there's a lot of things that I think we use intuitively and not really consider as being a technique.
Yes, because I've noticed that holding my phone, just out of habit, sometimes I'm up this close, and then I realize, I don't need it that close.
Yeah.
Just started doing that.
Yeah.
So the interesting part of this is that losing sight, losing one of our senses, the other ones might overcompensate for it, maybe, but not necessarily. But as we lose that one particular sense, a very vital sense, it starts to close in our world a little bit more. And so are you experiencing patients having to cope with isolation, depression, or anything, cognitive issues?
Yeah, absolutely. I think, and I was thinking about this too the other day, it's a little bit side and I'll come back to that, but I think because we are such visual beings, we tend to forget about the other senses. And something that I've been kind of experiencing lately with exploring some different projects is, what if, we're, just think about how people experience things and trying to do it in a different way where we're incorporating things like tactile and auditory and other kind of sensory things. It just makes me think that even even as people who are sighted, we're kind of missing the whole experience because we're relying so much on vision. So I think, being open to using these experiences just gives you a richer experience for one, just, listening to the sounds and the space, and again, tactile is another common technique. So for that, and then, but yes, coping, one, I think we self-isolate a lot. Things are different. So it's just like, well, I don't want to go out with these people, even though I enjoy their company, because, I'm going to have to rely on a ride from somebody because I can't drive and I don't want to burden them. So sometimes I think it's self-limiting in that respect. You don't want to, ask people for too much. That's pretty common. And then just the adjustment, the mental adjustment of what's happening. This isn't the way, this isn't my life. This is a whole new change, kind of that sense and loss of identity. We start to just kind of, our world just gets smaller and smaller. And so that's definitely something that I, try to work with my patients on, like, well, let's find ways to get back into the spaces that you want to be involved with. There's different, maybe we can't drive, but maybe, let's explore ride shares. Let's try things online. There's as horrible as COVID was, it did open up this whole like online community space.
Yes.
That, there's so many different things that we can do now online that we couldn't do before. Right. So there's definitely like lots of ways that we can explore that. I have a gentleman that joins our support group, and he says he's international now because he can do all these groups in different countries, and he's met people in different places that, he wouldn't have been able to do before.
That is the good side of it. Yes. And that it's interesting now, just listening to, as you described this, it's always that hindsight for me, that reflection that, oh gosh, I wish I would have seen this, or wish I would have known this before, because I do recall the times that Mom gave me a hard time about driving. And eventually some people struggle with their loved one giving up the keys. And this was not the case with her. She would, every time we went somewhere, it was like, hey, here, you drive. We'll use my car to save you some gas, but here, you drive. And she did it more consistently. And I didn't cue into that as being one of the probably more obvious signs now that her vision, she was struggling with some low vision. And then later in the years, taking her to her eye exams, we did find out that she had some early macular degeneration going on.
Yeah. And back to the part where you're mentioning about cognition too, lacking information from your vision. It's not allowing you to process your environment quite as much. We are missing information. And a lot of times, it's not uncommon, especially with our older population, to have hearing loss as well. They're using hearing aids. So you're getting that dual sensory loss that way. So they're missing even more information. And not being able to kind of participate in their world. My father-in-law actually had both of those issues. And I remember, he loved to be around family and be family gatherings, but a lot of times it was really loud, and he would just kind of be sitting there and kind of smiling because, he enjoys being with everybody, but he's not really being able to participate in the conversations as much. So you do definitely lose a little bit of that information, and it's not uncommon to have some cognitive loss with having that sensory loss too.
I think I saw the progression with Mom in the last year or so, where she refused to wear her glasses because they made her look old, or she didn't need them, and then when it came time to possibly needing hearing aids, she also refused those because those were for old people, not for her.
Right.
And so that was two senses right there that she denied herself being able to have some assistance in that. And I saw the depression a little bit more.
Yeah, for sure. We don't want to do things that make us stick out. Whether you're a kid, whether you're an adult, things that make us look different to other people. We don't tend to like that too much.
No, we want to fit in, and we want to be, especially when the whole being hip and trendy, and it is a challenge. But one thing I've noticed is stress also contributes. And when a person is losing their senses, they're stressing.
Mm-hmm.
Whether they're making it known to you or not, that's a stress factor, which in turn makes everything, it just raises everything else. It makes it worse. Have you been able to work with patients in reducing stress or?
Yeah, a lot of times I notice the stress when we are kind of learning to use a new technology. So, for example, I'll pick on like phones for a minute, but a lot of times I get that question too, like what's a good phone for my elderly relative who can't see very well, and so then we also kind of think about the cognitive load on that too. It's like, well, if they weren't using a smartphone before, and now we want to teach them to use a smartphone,
Right.
and then teach them to use an app, and then teach them what these accessibility features are. That's a lot to learn in a short period of time. So just kind of, I think, understanding what it is like you're expecting from that. It's like, I mean, even for us, learning, getting the new version of a phone, there's going to be something different.
Yes,
we have to get used to
always.
it. So it's going to take time. It's going to take practice. And so just kind of, reinforcing that with them, like this is going to take time. I know you're going to get frustrated, but the more you do this, the more comfortable you'll be with it. And then getting some buy-in too. So I try to find out, again, like everybody's like really specific about what their needs are. So it's like, well, if we're looking, for example, go back to the phone. What do you want to use it for? Are you texting? Are you looking at pictures? Facebook is kind of a big one. Like social media, wanting to look at families' photographs and stuff. And then once we can kind of apply some of this stuff to those types of things, then they get a lot more interested. Like, oh, I can really look at their pictures and I can see it. Oh, I couldn't see this before. Like now they, the emails that I get, I can see them now because before I couldn't.
Which feels good.
Yeah, absolutely.
Makes it worth learning something new.
Yeah.
So in this case, learning something new may be just accepting that this is happening and finding that place of comfort, which is why I like your name of the company is Empower, and it includes the name Empower. So as you're trying to help people adapt and change, what are you hoping to do through your company and as far as empowering others and dealing with low vision?
I think I've seen this a lot with the people in my support group, just because we've been together for a few years now, and kind of seeing like when they came in and were kind of struggling with some things. And I think now, there are some that work still, and how they are more empowered now to, speak up to their employers about, adaptations for the workplace, or, even advocating for other, for just information for people that are new to our calls, and other resources in the community, even kind of outside the community, thinking like other phone groups and stuff, for resources that are beneficial. I've seen that a lot, and that's pretty cool to see. And then it's not just that person, but hopefully with their family, and to some extent, myself as well, wanting to empower myself to kind of be this better advocate for my patients, and just kind of carrying that with them in the community. Because I think, again, back to a lot of people don't know that this is out there, and then the more that they can increase the awareness to the people that are close to them, it just spreads. So it has that ripple effect.
Definitely, because this is the type of information that we don't know of it until we're in it, and then it's a scramble and the panic and trying to cover up or trying to fix it before it gets worse, and that's hard to start when you're in it as opposed to being aware of it. So in that respect, what are some things people might need to keep in mind that if they're experiencing certain things like symptoms or something, to be have that be their red flag of, oh, I need to get this checked sooner than later?
Yeah, I would say it's good to have regular eye exams. That's kind of like the best thing to catch it. And then that's even with whatever general eye doctor that you're seeing, they're going to be able to catch early signs of it, and kind of let you know that's the progression. As I mentioned, like these are mostly what I'm dealing with mostly are age related conditions. So these are more frequent with age. So as you're getting older, it's something that you're going to notice. Certain things like, for example, light, we do need more light as we get older. That's just a fact. But if you notice it's hard to maybe see stairs, like where the edge of the stair is, it might be difficult to see like how clean your plate is, like if you're cleaning your dishes, not being sure if they're really clean. And those are both issues with contrast that are common with age-related conditions. And also what's good for the heart is good for the eyes. So that's kind of like a good rule of thumb, making sure you eat your rainbow of colors on your plates and getting your exercise. But if you're not getting those things, that those are simple things that you can do. And if you have a relative that has these conditions, that also increases your risk of getting it. So that can kind of help put that on your radar and kind of, ask your doctor about those, specific tests. And there is genetic testing out there that you can do if you are concerned about developing it. So.
That's definitely something I was concerned with because just like with mom and her mixed forms of dementia, I wanted to be aware of it so that I can now be focused on, not entirely focused, still living life, but be aware of, this is one of those things that happened with mom. Maybe I do need to pursue this a little bit more. But I'm so glad that you mentioned about the food because I believe food is our medicine. And just as we would need to eat more red foods, fruits and vegetables for the antioxidants, we also need to eat more of the orange and yellow fruits and vegetables because that's where carotenoids come from, the beta carotenes and all of that help the eyes. And that's stuff that I would have never considered growing up. It just, even as a young adult, I would have never considered that, knowing if I'm hungry, what to eat, as opposed to, okay, make sure I have this color of the rainbow on my plate for breakfast, lunch, and dinner.
Yeah, absolutely. And I think those are also good conversations to have with your doctor because depending on if you have other medical conditions, I know you may be limited from eating certain things. So you might not be able to eat, have lots of vitamin A because that affects, whatever. There's a counterindication with one of the medicines that you're taking, but being able to find alternatives to make up for that. So you're still getting the nutrients that you need. But yeah, staying healthy, not smoking, avoiding drinking, things like that also can be good. Make a big impact.
That's awesome. So going forward, what is your goal to expand with the company and what do you see in the near future for, pun intended, what do you see for your company going forward?
I really enjoy collaborating with different professionals. So I'd like to be able to find ways that, we can kind of collaborate in ways that are outside that traditional rehab environment, and just kind of show the benefits of OT and what we can do, and for the benefit of our populations. Access to our environment, accessibility in general are important. We need to be able to access our environment. So ways that we can together make that better for people, better for low vision, but that also, makes it better for everybody. So it's not just those groups. So even though that's that's my focus and that's my passion is low vision, I really think that, the benefits can be shared by everybody. It's not just for one group. And when it comes to things that are like technology, if there's something that benefits more people, that also helps bring the cost down. So technology like Alexa Google, speakers and things like that can be very helpful if you have low vision, but are helpful for other people too. So that's also doesn't make you stick out because everybody can use it, but that technology is pretty affordable. So being able to maybe be more involved in that space and kind of advocating for, for this group to be able to access that.
See, and one thing that is also interesting, and I've learned to pay closer attention to this, is that this is something that may affect, it's more typical to affect an older group, but it's not always the case. And so it's just like when the eye doctor said, oh, you're reaching that age, you're between that age of 45 and 52, and people start needing bifocals or you're relying on readers more. I'm also in that age group that low vision would be an issue. So it's not something we should or could dismiss just because of it's an older age related. And I think a lot of people do that when it comes to certain health ailments, especially dementia. It's for older people when it's happening more to people. And I mean, we're on our smartphones more often and we're in dim lighting more often and we're doing things that are not helping our vision. So it's affecting us younger. So.
Yeah. I know that there's definitely some studies that are being out there now about, the amount of screen time, especially like school age kids. And kids being given access to screens at an earlier age. I mean, they're just a part of life. So absolutely, we're going to see more and more of that being an issue where it does affect us possibly even functionally, but it's not technically within that low vision spectrum. Like it doesn't really quite meet those qualifications. And that's absolutely going to be an issue for sure.
So what is, before we begin to wrap, what are things that you want other people to be aware of or know specifically when it comes to low vision? So first of all, that there's no magic glasses. There's no cure, at least as of yet. I know there's definitely a lot of work being put into that. But if you do get low vision, you have that diagnosis. Seek out resources as early as possible, and find your community, because there is a community out there that can help you, like provide all sorts of support and just information. Being open to new things. If it's not maybe not the way that you've done things in the past, but it can give you kind of back. Trying something new can give you some of your life back. Oh, definitely.
So yeah, just being open to that. And it's just, new things are going to take a little bit of time and not get frustrated. But it's, there's a lot of really cool things out there, if you're kind of open to it. So.
Yes. And that's the key. We actually have to remain open to it, because when it comes time to researching, it can be very overwhelming, very frustrating, but in the long run, it can help save or at least postpone more vision loss. The sooner the better.
Absolutely.
So for those who are local especially, how does the public find you and your services to be able to reach out for more information?
So I do have a website. It's called... It's at www.icanrehab.com for Empower Occupational Therapy. I am on Instagram and Facebook as well, which is where I'll be better about this, providing more information about the things that we're doing in the community, like our support groups and other kind of outings that so that way we can do things more in person as well. And those are probably the best way to find me at this moment, but I'm looking to explore and be more out there for people to find me.
Definitely, because this is something that is an issue that is growing, and it's beneficial for us to know as much as possible sooner than later and not dismiss the issues. So I am glad you were doing what you're doing. And when I look back now, I wish I knew so many more things, but you're here now and you can help so many more people going forward. So thank you.
Thank you so much.
Alrighty, ladies and gentlemen. Thanks for joining in and listening today. I hope this episode gave you a lot more food for thought. And for more episodes like this, you can find us at proactivecaregiver.com and on YouTube. Until next time, be proactive. Take care, everybody.